Hello, thank you very much for your interest in training in child and adolescent psychiatry with the Mayo Clinic here in Rochester, Minnesota. My name is Dr. Paul Croarkin. I'm a child and adolescent psychiatrist with the Division of Child and Adolescent Psychiatry in the department. I also direct the Mayo Clinic Depression Center. I wanted to speak with you briefly about opportunities available for fellows in the area of interventional psychiatry and broadly about resources available within the Depression Center. We have a thriving interventional practice here at the Mayo Clinic that child and adolescent psychiatry fellows are often involved in. This includes a very busy electroconvulsive therapy service that on occasion does treat adolescent patients. We also have ongoing research protocols for repetitive transcranial magnetic stimulation. Historically, this has involved standard 10 Hertz protocols delivered to the left dorsolateral prefrontal cortex. We've executed a number of open label studies and more recently led a randomized controlled trial across multiple centers. Currently, we have a dose finding study that involves treatment with 1 Hertz, 10 Hertz, continuous theta burst, or intermittent theta burst stimulation. We have plans underway to launch an accelerated protocol, meaning TMS treatments will be delivered more than once per day with a concurrent intensive outpatient program. We also have research protocols with transcranial direct current stimulation, and importantly, we have a very busy ketamine infusion service and recently began delivering S-ketamine as well. Within this area of interventional psychiatry, we also have a rich collaboration with our colleagues in neurology in the area of deep brain stimulation. These clinical and research protocols typically involve epilepsy and movement disorders in which psychiatric symptoms and disorders are tracked and treated carefully. We on occasion do have adolescents in these protocols as well. Fellows have the opportunity to rotate and get hands-on experience with these modalities, more training, more comfort, and more involvement in research as their interest dictates. My bias is that this will be a growing and important area for child and adolescent psychiatry and in the treatment of young adults in particular. Beyond this, I wanted to emphasize some of the resources available in the Mayo Clinic Depression Center. We have a number of case conferences, visiting scholars, and we have a number of unique resources for career development and research as well. The faculty within the child and adolescent psychiatry program and the Depression Center and the department at large are very invested in career development and research training in particular for fellows that have interest. Not all fellows want to do this beyond the general requirements, which is fine, but those that do, there are ample opportunities to publish case reports, case series, retrospective studies. On some occasions, fellows have designed and executed very compelling prospective research with often subjects on our inpatient unit, for example. Any of these opportunities are possible, and there are a number of faculty members that serve as mentors. And there's also the opportunity to get involved more as a collaborative role on ongoing projects as well. So I want to wish you the best for your recruitment season in terms of finding the best fit for training, and we hope that we can be helpful in your career moving forward regardless. Thanks again, and take care.